Hi, I'm Dr. Chris. I'm a practicing chiropractor. I'm the founder of Muscle Care. I see 55,000 patient visits a year in my practice. We understand pain. If you or anybody you know or love suffers from asthma, please give them this mini series of stretching. I promise it will help them tremendously. The Super 6 rules to stretch are: warm up, be gentle, no sharp pain, breathe, always do both sides, don't bounce, and always hold for at least 30 seconds or until you feel the muscle relax. Now that we're warm, let's get some relief. For an effective side of neck stretch, let's keep the feet shoulder width apart. The pelvis is square to the ground and your hips are right under your shoulders. Your ears are over top of your shoulders. And all you're gonna do is keep your nose straight ahead and tilt your right ear to your right shoulder. Do not let your nose point down. The nose stays straight ahead. You're trying to get 45 degrees, and remember your Super 6 rules. You're gonna do the other side the same way. For the back of neck stretch, stand, feet shoulder width apart, pelvis square, slight pelvic tilt if you'd like, shoulders over the hips, ears over the shoulders. And now, in order to get the back neck muscles, what you'll do is simply rotate your face to the right, keeping the jaw parallel to the ground. And again, go to comfort. If there's any sharp end feel, back it off a little bit. If you feel dizzy, back it off and do less. For the front of chest stretch, your right arm should be perpendicular, parallel to the ground, and you would actually try to hook your hand onto a wall for support. And if you can extend your fingers backward in order to open up the fascia and connective tissue of the forearm and the hand, you'll get a much better stretch all the way up the arm, all the way through the chest. But remember, what you want to do is feet are planted square on the ground, and you rotate your body away from the side you're stretching. That includes your neck. So if your right hand's on the wall, you'll turn your face and your torso to the left. Okay, do the same thing on the other side for balance. What we're gonna do now is a torso stretch. Hips should be right under the shoulders, ears should be right over top of shoulders, and you'll do a torso stretch. You can hold your hips and just twist the spine and the neck all the way up to the top in rotation to the left. Do not move your hips. As you've done this stretch and you've held it for 30, then for more stretch, you can turn your pelvis further to the one side. Do both stretches equally on both sides. For the side of spine, make sure that you actually open up your legs. They're wider than shoulder width for stability. Put your left hand on the left side of your lateral left leg or hip. The right arm goes straight up in the air and you lean to the left side. So your right arm should be pointing to the left and it should be straight all of the time. Do both sides exactly the same. Now, reach around out front. Put the left hand on the back of the right one and push away from you, but do not round out. Stay straight. Open those muscles up in the upper back. Stretch them. Keep the head straight, ears over shoulder. 5 to 10 seconds. Repeat that 5 to 10 times. For the tricep stretch, it's really important that you stand with your feet shoulder width apart and you keep the ears over the shoulders, shoulders over the hip. The right arm reaches up, bends to 90 degrees over the back of the head. Still keep the head up. Many people want to drop the head forward. That's not what we want to do. Reach up with the left arm, grab the right elbow, and pull to the side, okay? Pull over to the left side. Stretch the armpit and the back of the tricep on the right side. And if you lean more to the left, you get more latissimus and tricep stretching at the same time. Make sure you do both sides. For the lower chest stretch, the right arm, for example, has to go 45 degrees above the horizontal. So it reaches up, making sure that the palm of the hand is held onto something tight and strong like a wall or a post. And if you can actually extend the wrist or the fingers backward while you do that and turn your body away from that side, including the head and neck, you're gonna stretch all the connective tissue of the chest and the neck that all work together. To stretch the upper chest fibers, your arm would point down at 45 degrees away from the body. Hook the fingers on a wall or a post. Let them go backwards. Open up that connective tissue. And then turn your face and upper body to the left, away from the side of the upper chest fibers you're stretching. Let's sit neutral or stand neutrally, ears over shoulder, let's not slouch, and let's gently open the mouth as wide as we can without pain. And hold that for 30 seconds to reduce masseter and temporalis tension in the side of the face. What happens when we look down at our phones all day, we actually retract and pull our jaw backward. We create a lot of tension behind the jaw, around the ears, again, blocking blood flow, blocking lymph. So what we want to do is we want to sit tall or stand tall, ears over shoulder, and open your mouth, and slowly but surely protrude the lower jaw out, again, to the point of comfort and a nice gentle stretch for 30 seconds, and then relax. This may take a few reps. This particular rotator cuff stretches on both sides. We start by getting our arms parallel to the ground, okay? Our upper arms or humerus parallel to the ground, elbows bent to 90 degrees. Try to get your hands back, and then you rotate forward, keeping the arms parallel to the ground. Do that stretch for 30 seconds, and then repeat it again. If you're doing back extension, back flexion while you're on your hands and on your knees, that's called a tabletop. Start in a tabletop where the spine and the neck are perfectly straight. Then, simply let the tummy drop forward to the ground, arc the back, look up. Let's open up the front of those neck muscles that are tight from looking down at our phones all day. Let's get that extension in the back. So arcing is fantastic. Hold that for 30 seconds. Once you've done that, reverse. Go into a C curve, looking downwards. Again, don't make it hurt. Just gentle stretch. And I'd advise staying in that position for flexion shorter, 15 seconds, and then go back into extension, because that's where you're gonna get the most amount of benefit in today's society that we live in. You feeling better? I knew you would. Listen, why don't you continue your pain-free journey by clicking the link in the description below and access my full stretching series and share the relief of pain and stress with friends and family. And you know what? If you really want to feel even better, why don't you try this? Muscle Care is the new sub-topical, all-natural, evidence-based pain, spasm, and inflammation reliever. You're gonna love it. It's easy to use, simple to put on, no mess, no fuss. It's a roll-on. I'm Dr. Chris, and have a great day.